Hey guys, please watch my video till end because the quality content which I will provide you will be priceless and very useful to you. It might change your life, so I don't think you will skip my video, so let's start the powerful video. Since the beginning of time, ginger, also known as the root or rhizome of the Zingiber officinale plant, has been utilized as a popular spice and medicine for medicinal purposes. The herbal traditions of Asia, India, and Arabic have all made extensive use of it for a very long time. Before starting the video, please do not forget to like, share, subscribe, and press the bell icon for new interesting videos. Over the course of more than 2,000 years, ginger has been utilized in China as a means of facilitating digestion and treating gastrointestinal distress, diarrhea, and nausea. Ginger has been utilized in the treatment of a variety of ailments, including arthritis, colic, diarrhea, and heart disorders. A number of conditions, including the common cold, symptoms similar to the flu, migraines, and painful menstrual periods, have been treated with it. Over the course of at least 400 years, ginger has been utilized as a culinary spice in Asia, where it is indigenous to the region. The rhizome of ginger is a thick, twisted, and beige underground stem. It is the plant's distinguishing characteristic. Approximately 12 inches above the ground, the stem is characterized by long, narrow, ribbed green leaves and flowers that are either white or yellowish-green in color. What makes it up exactly? Researchers believe that the volatile oils and pungent phenol chemicals found in ginger root, such as gingerols and shogols, are the components that are responsible for the root's efficacy. Uses and indications for medicinal products. The use of ginger as a treatment or preventative measure for nausea and vomiting caused by motion sickness, pregnancy, and chemotherapy for cancer is becoming increasingly common among medical professionals. Additionally, it is utilized in the treatment of moderate stomach disturbance, the alleviation of pain associated with osteoarthritis, and it may possibly be utilized in the treatment of heart disease. Sensitivity to motion. It has been suggested in a number of studies, albeit not all of them, that ginger may be more effective than a placebo in alleviating certain symptoms of motion sickness. It was shown that those who took powdered ginger experienced less instances of vomiting and cold sweats than those who took a placebo in a study that involved 80 new sailors who were prone to experiencing motion sickness. The ginger, on the other hand, did not alleviate their nausea. The same thing was discovered in a study that involved healthy individuals. Other research, on the other hand, discovered that ginger does not function as effectively as drugs for treating motion sickness. People were given either fresh root or powdered ginger, scopolamine, which is a drug that is widely used for motion sickness, or a placebo in a research that was quite modest by comparison. Compared to those who took ginger, those who took scopolamine experienced a lower number of symptoms. Ginger does not have the same side effects as conventional prescription and over-the-counter drugs for nausea, such as dry mouth and sleepiness. Ginger, on the other hand, does not have these negative effects. Nausea and vomiting that are specific to pregnancy. When administered for a short length of time, no more than 4 days, ginger, which contains 1 gram per day, has been shown to lessen nausea and vomiting in pregnant women, according to research conducted on humans. When it comes to alleviating morning sickness, ginger has been shown to be more effective than placebo in a number of trials. Those pregnant women who took 1 gram of ginger every day for 4 days reported experiencing more alleviation from their vomiting than those who took a placebo. The study was conducted on 30 pregnant women who were experiencing severe vomiting. A larger trial that included 70 pregnant women who were experiencing nausea and vomiting found that those who received a comparable quantity of ginger experienced less nausea and did not throw up as much as those who received a placebo. Before consuming ginger, pregnant women should consult their physicians and should not consume more than 1 gram of ginger each day. Nausea caused by chemotherapy. There have been a few studies that suggest ginger can lessen the severity and length of nausea that occurs after chemotherapy, but it does not prevent vomiting. On the other hand, ginger was administered in conjunction with another anti-nausea medication in one of the investigations. As a result, it is difficult to determine whether ginger had any effect. Additional research is required. Symptoms of nausea and vomiting following surgical procedures. There is a lack of consensus among researchers over whether or not ginger can ease nausea and vomiting after surgical procedures. Researchers found that taking 1 gram of ginger root before the surgery was just as effective as taking a leading drug in reducing nausea. One of these trials found that women who consumed ginger after surgery need fewer nausea drugs than those who did not consume ginger. Ginger, on the other hand, was not found to be effective in reducing nausea in other research. Ginger, according to the findings of one study, may potentially cause an increase in vomiting after surgical procedures. Further investigation is required. Osteoarthritis, OA. For generations, ginger has been utilized in traditional medicine for the purpose of reducing inflammation. Ginger may also be able to alleviate the discomfort that is associated with osteoarthritis, OA, according to some data. In a trial that involved 261 individuals who suffered from osteoarthritis of the knee, those who took ginger extract twice daily experienced less pain and required fewer drugs to alleviate their discomfort than those who were given a placebo. Ginger was not shown to be any more effective than ibuprofen, Motrin, Advil, or a placebo in relieving the symptoms of osteoarthritis, OA, according to another study. In order for ginger to take effect, it can take a few weeks. Additional applications. Ginger has been shown in preliminary research to have the potential to reduce cholesterol levels and aid in the prevention of blood clots. The treatment of heart disease, in which blood vessels can become blocked and lead to a heart attack or stroke, can be aided by this in some cases. Ginger, according to the findings of other studies, may be able to promote better management of blood sugar levels in patients who have type 2 diabetes. It is necessary to conduct additional study in order to ascertain whether ginger is safe or beneficial in treating diabetes and heart disease. Forms to choose from. Products created from ginger are made from either fresh or dried ginger root, or they are made by steam distilling the oil that is found in the root. Extracts, tinctures, capsules, and oils are all forms of ginger that can be found. You might also create a tea out of fresh ginger root that you purchase. A wide variety of foods and beverages, such as gingerbread, ginger snaps, ginger sticks, and ginger ale, all contain ginger, which is a common spice used in cooking. Ginger can also be found in ginger snaps. Extreme caution. Utilizing herbs as a means of bolstering the body and treating illness is a method that has been around for a very long time. On the other hand, herbs have the potential to interact with other herbs, vitamins, or pharmaceuticals, as well as cause adverse consequences. In light of these considerations, it is recommended that herbal remedies be consumed under the guidance of a medical professional who is certified in the field of alternative medicine. It is quite uncommon for ginger to cause adverse consequences. A moderate heartburn, diarrhea, and irritation of the tongue are all possible side effects of taking it in high dosages. If you take ginger supplements in the form of capsules, or if you consume ginger with meals, you may be able to avoid some of the moderate gastrointestinal side effects such as belching, heartburn, or stomach discomfort. Prior to consuming ginger, individuals who suffer from gallstones should consult with their physicians. In the event that you are taking ginger prior to undergoing surgery or being put under anesthesia, it is imperative that you inform your physician. Women who are pregnant or breastfeeding, persons who have cardiac issues, and people who have diabetes should not consume ginger without first seeing their physicians. Under no circumstances should you consume ginger if you suffer from a bleeding disorder or if you are currently taking medications that thin the blood, such as aspirin. The potential for interactions. There is a possibility that ginger will interact with both prescription and over-the-counter medications. In the event that you are currently using any of the medications listed below, you should not consume ginger without first consulting with your primary care physician. Ginger may lead to an increased risk of bleeding when combined with blood-thinning drugs. Before beginning to consume ginger, it is important to consult your physician if you are currently using blood thinners like warfarin, Coumadin, clopidogrel, Plavix, or aspirin. There is some evidence that ginger can help reduce blood sugar levels. Hypoglycemia, often known as low blood sugar, can be more likely to occur as a result of this. Ginger may lower blood pressure, which may increase the risk of low blood pressure or irregular pulse. Other drugs for high blood pressure may also lower blood pressure. What is the pediatric dosage for it? Ginger should not be given to children younger than 2 years old. Ginger is an effective treatment for nausea, stomach cramps, and headaches in children older than 2 years old. You should consult your physician in order to determine the appropriate dosage. A grown-up. You should not consume more than 4 grams of ginger on a daily basis, including ginger that comes from food sources. A daily dose of more than 1 gram should not be taken by pregnant women. For nausea, gas, or indigestion, 1 gram of ginger, taken in divided doses, has been shown to be effective in a number of studies. Ask your physician to assist you in determining the appropriate dosage for you. There have been trials that have utilized 650 mg to 1 g per day for the treatment of pregnancy-induced vomiting. Ginger should not be consumed without first consulting with your physician. In one trial, 250 milligrams 4 times a day was used to treat arthritis pain. Like, share, comment, and subscribe to our YouTube channel if you want more content like this. See you in my next powerful, interesting, and informative video.